Everyone thinks the next AI boom will look like the last one. Smarter chatbots, faster models, bigger apps. That's the expectation. But the next explosion won't happen on your screen. It's happening inside cells. And once you see what's already unfolding in biology, you won't look at AI the same way again. AI is designing proteins from scratch for most of human history. Biology was something we observed. We studied it, we mapped it, we tried to understand it, now we design it. DeepMind's AlphaFold database released predictions for more than 200 million protein structures. That is not just a research milestone. That is centuries worth of experimental biology compressed into a public digital resource. More than 3 million researchers across over 190 countries now use it. Around 1 million of them are in low and middle and no nations. This is no longer isolated lab science. It is global infrastructure. And it goes further. MIT's Boltzmann model was tested across 26 targets in 8 separate wet laboratories, demonstrating that AI-generated proteins can actually be fabricated and studied in the real world, not just simulated, built. MEASURED, verified. Let that sink in. AI can now design brand new proteins that have never existed in nature at atomic precision. Proteins are not abstract concepts. They are the machinery of life. They regulate cells, catalyze chemical reactions, hit by your tissue, and coordinate biological processes. If you can design proteins, you are not just studying biology, you are engineering it. But designing proteins is only the outer layer, because if proteins can be written, what does that imply about DNA itself? Biology is now programmable. Proteins are the machinery of life. DNA is the instruction set that builds them, and for most of modern science, that instruction set could be read but not rewritten. That limitation is gone. After the first approval of a CRISPR-based medicine, around 50 treatment sites opened up across North America, Europe, and the Middle East. This is not research sitting in journals. It is deployed medical infrastructure. In one case, a customized CRISPR therapy for an infant was designed, manufactured, and delivered in just 6 months. Drug development has historically taken years, sometimes decades. 6 months signals a structural shift in capability. Precision is improving as well. Profluence AI designed enzyme open CRISPR-1 reduced off-target editing by 95% compared to traditional CRISPR enzymes and company assays. Editing DNA is powerful. Editing the wrong sequence can cause unintended damage. Reducing unintended edits at that scale changes the risk equation. AI is not just accelerating gene editing, it is refining it. With CRISPR and AI combined, scientists can now decide what to rewrite inside DNA. Evolution used to be blind and slow, operating across generations. Now, there is a feedback loop, and when you zoom out, something deeper becomes obvious. Biology runs on instructions, literal instructions. Biology runs on code. The human genome contains roughly 3 billion bases, 3 billion letters arranged in a precise sequence. If you printed those 3 billion letters in 12-point font, that text would stretch about 164 miles, roughly the distance from Boston to Houston. That entire instruction set exists inside nearly every cell in your body. DNA is not a metaphor for code. It is code, 4 letters, billions of instructions. A molecular programming language that determines how cells behave, divide, pair, and specialize. And here is where it becomes almost difficult to comprehend. 1 gram of DNA can theoretically store about 215 pabits of data. The world's 175 zettabytes of digital information could fit into just 81 kilograms of DNA. Another estimate suggests that 1.8 zettabytes of global data could fit into just 4G. 4G is smaller than a teaspoon. Biology does not merely resemble computation in terms of storage density. It surpasses anything we've built in silicon. Once you realize DNA is programmable code stored in ultra-dense biological hardware, the next question becomes unavoidable. What happens when the cost of reading that code collapses? Because that is exactly what happened next. The genome cost collapse. The first human genome costs roughly $2.70 to $3 billion to sequence. It took years of coordinated international effort. By 2014, that cost had dropped to around $1,000 per genome. By 2024, sequencing could be as low as $600. In 2025, some whole genome tests cost around $400, and companies in China have announced plans to push that number down to roughly $100 per person, from $3 billion to potentially $100 in just a couple of decades. That is not gradual improvement. That is a collapse in cost. And whenever costs collapse, data explodes. We've seen this pattern before. When storage became cheap, the internet exploded. When compute became cheap, AI models exploded. Now, genome sequencing is collapsing in cost, which means biological data is about to expand at scale. Once that data begins flowing into AI systems, we move beyond analyzing text, images, and speech. AI begins analyzing life itself. And that is where the next transformation begins. Because when you combine massive biological data sets with machine learning models trained on them, drug discovery stops looking like chemistry and starts looking like engineering. AI turns drug discovery into engineering. For decades, drug discovery looked like organized guessing. Scientists would screen millions of molecules, most of them failing. A few would survive years. Would pass. It was slow, expensive, and brutally inefficient. Now, something different is happening. In silico medicine advanced a fibrosis drug candidate from discovery to human trials in under 18 months. Traditionally, that process takes between 4 and 6 years. That is not a marginal improvement. That is compression on an entirely different scale. And it's not only about speed, it's about probability. AI-assisted drug candidates are achieving phase 1 success rates close to 90%. While traditional programs typically fall between 40 and 65%, that gap changes the economics of medicine. Drug development has always been constrained by time and failure rates. Reduce both, and the entire system begins to shift. In 2016, there were just 3 AI-designed drug programs. By 2023, that number had grown to 67. Projections suggest they could exceed 173 by 2026. That is not incremental growth. That is acceleration. Instead of testing molecules randomly in physical labs, AI now simulates interactions digitally. It predicts structures. It filters millions down to the few worth physically producing. Drug discovery stops looking like chemistry roulette and starts looking like engineering. And when something becomes predictable, capital follows. Billions are quietly moving into bio. Most public headlines still focus on chatbots, but the capital markets are signaling something else. Venture capital funding for AI-oriented biotech and healthcare startups peaked at around $122.5 billion in 2021. It dipped during the broader tech slowdown, then recovered to $6.7 billion in 2024. The recovery matters because it shows sustained conviction. In 2024 alone, U.S. healthcare startups raised approximately $23 billion. Nearly 30% of that capital went directly to AI companies. Globally, venture funding for AI drug discovery reached $3.3 billion that same year. Some of the deals are enormous. Generate Biomedicine secured a $1 billion partnership with Novartis. Isomorphic Labs expanded with more than $600 million dedicated to integrating AlphaFold into drug design. These are not small experimental bets. These are pharmaceutical giants restructuring around AI native biology. Money rarely moves at this scale without long-term belief. Science leads quietly. Capital follows loudly. And when both align, expansion accelerates, but scale requires something else. Data. The biological data tsunami. Every single human genome sequence produces more than 200 gigabytes of raw data. That's one person. Now scale it. Analysts estimate more than 100 million genomes could be sequenced by 2025 researchers' project. That between 2 and 40 exabytes of storage may be required just to hold human genomic data by that point. Over the next decade, genomic research alone could generate between 2 and 40 exabytes. 1 exabyte equals 1 billion gigabytes. And genomes are only the foundation. Layer on protein mapping, high-resolution cellular imaging, molecular simulations, global clinical trial datasets. Each adds another stream to the flood. The volume compounds fast, Biological data is now expanding at a pace comparable to the early internet era. Exploded first, then content. Eventually, AI became necessary to interpret it. The same curve is forming here. AI does not merely benefit from biological data, it becomes indispensable. No team of human researchers can manually interpret billions of protein structures, genomic variations, and cellular interactions at planetary scale. Only large models can. And once foundation models are trained not just on language but on life itself, the entire AI stack shifts. D new I stack. The first AI boom, automated information. The next one redesigns biology. We are already seeing biological foundation models emerge. Evolutionary Scales ESM3 contains 98 billion parameters and was trained on 2.88 billion protein sequences. It required roughly 25 times more floating point operations and 60 times more training data than its predecessor. That is not a chatbot trained to predict sentences. It is a model trained to reason about life at molecular scale. The economic backdrop reinforces the shift. The global AI market is now projected to grow from about $214 billion in 2024 to $1.339 trillion by 2030. Life sciences is one of the industries most deeply positioned for transformation. At the same time, public sentiment reflects tension. Around 50% of Americans report feeling more concerned than excited about AI's growing presence in daily life. That reaction is understandable because this next phase is not about faster search results or smarter recommendations. It's about rewriting proteins, editing DNA, and designing organisms. The first AI boom, automated memory. This one engineer's life. When you zoom out, the pattern becomes clear. Energy, scaled muscle. Information, scaled memory, AI, scaled judgment. Now, intelligence turns inward. Biology becomes programmable. Medicines become computational. Evolution becomes design. The next AI boom will not be louder. It'll be deeper. It will not just change what we build. It will change what we're capable of becoming. And it's already begun. If you made it this far, let us know what you think in the comments section below. And if you're curious about how fast AI and research workflows are evolving behind the scenes, you can also check out Overseer OS in the description. For more interesting topics, make sure you watch the recommended video that you see on the screen right now. Thanks for watching.